Hello and welcome to my YouTube channel, Anatomy Mentor. Today we have a discussion topic, which is a very important topic of neuroanatomy. And this is normally a really vast topic, but we're going to summarize it today. That is the blood supply of the cerebrum. So our learning objectives for today's session are that we are going to be discussing the origin, the course and branches of the main arteries which are supplying the brain. And we shall be also talking about the Circle of Willis and the cerebral circulation. And also we will focus on the areas which are supplied by the three main cerebral arteries, which are anterior, middle, and posterior cerebral arteries. And we will correlate that with the clinical outcome in case of occlusion of cerebral arteries. And just a little brief discussion at the end will be on the venous drainage of the brain. So this is what we shall be talking about today. And this is a topic which is very important when it comes to the conceptualization of the blood supply of the brain tissue, and also from an examination point of view, from the attempting of MCQs, you should be familiar with the blood supply of the different parts of the brain. So before I start with this topic, a few facts, a very basic facts which you should know is that our brain is a highly vascular organ. It is receiving about 15% of the cardiac output. This is because of the high functioning neurons in our brain, which consume about 25% of the total oxygen. So the very basic thing when we talk about the blood supply of the brain, the very basic thing to remember is that the brain is supplied by two main systems of blood vessels. Now, one of these systems is known as the carotid system, and the second one is known as the vertebro-basilar system. So here is a sagittal section of the head and neck region. And if you just follow the pointer over here, I'm going to show you the origin of the carotid system. So this here is the common carotid artery. On the right side, it is a branch of the brachiocephalic artery, whereas on the left, it is a branch of the aorta. This common carotid artery, as it ascends the neck, divides into two branches at the level of the upper border of this here thyroid cartilage, or we could say between the third and fourth cervical vertebrae. Now it divides into external and internal carotid arteries. So we'll be looking at internal carotid artery in the neck because this is the one which is eventually going to enter the skull and will supply the brain. Remember, this internal carotid artery enters the skull through this here opening or passageway, which is known as the carotid canal present within the temporal bone. And then it enters the cavernous sinus. It gives off a few branches like the ophthalmic artery and the posterior communicating artery, and then ends by dividing into the two terminal branches, which are the middle and anterior cerebral arteries. Now, let's look at the second part of the blood supply to the brain, which is through the vertebral system. This here is the vertebral artery. It's a branch of the subclavian artery. It ascends through the foramina transverse area of the upper six cervical vertebrae. And you can see here, as it enters the skull through the foramen magnum, it becomes united with the vertebral artery of the opposite side to form a single channel. That is the basilar artery. This union of the two vertebral arteries takes place at the lower border of the pons, and the basilar artery then ascends and it divides into the two terminal posterior cerebral arteries, which are joined by posterior communicating artery to form, as you can see here, a circular ring, which is known as the Circle of Willis. So this Circle of Willis is formed at the base of the brain. And now different branches which arise from the Circle of Willis are going to supply different parts or segments of the brain tissue. So this is what you have to remember, that there are two internal carotid and two vertebral arteries, and they're lying within the subarachnoid space, and their branches form a complex anastomosis on the base of the brain known as the Circle of Willis. Now, the branches of cerebral portion of internal carotid artery, we're going to summarize them, and we should know, I showed you the ophthalmic artery. This is a branch which arises just before its termination, and this is the branch which enters the orbit through the optic canal And as it enters the orbit, it is going to supply the eye, the surrounding structures, and its terminal branches are also going to supply the dorsum of the nose, the ethmoidal and frontal air sinuses, and also the frontal area of the scalp. Posterior communicating artery was the branch which completes the Circle of Willis at the base of the brain. Plus, there is also a choroidal branch which goes to the choroid plexus in the inferior horn of the lateral ventricle. The terminal branches, as I showed you, are the smaller anterior cerebral and the larger and more prominent middle cerebral arteries. Let's summarize the branches of the vertebral artery. Here you've got the meningeal branches which supply the bone and the dura mater in the posterior cranial fossa, plus the medullary branches which are going to medulla oblongata, and then the spinal branches which go to the spinal cord. Those are anterior and posterior spinal arteries. The anterior spinal artery, remember, is formed by branches which arise from vertebral arteries of both sides, and they unite and they form a single anterior spinal artery, which then descends on the anterior surface of the spinal cord. And then you've got the posterior spinal artery on the posterior surface of spinal cord. Remember, both of these spinal arteries are reinforced by radicular arteries which enter the vertebral canal through the intervertebral foramina. There is a branch of vertebral artery, a large prominent branch to the cerebellum known as posterior-inferior cerebellar artery. Now, let's summarize the branches of the basilar artery. So as I told you, the basilar artery is formed by the union of the two main vertebral arteries, and it gives off small numerous branches which enter the substance of pons known as pontine arteries, plus a labyrinthine artery which passes through the internal acoustic meatus with the 7th and 8th cranial nerves, namely the facial and vestibulocochlear nerves, to reach the inner ear. And then the branch to the cerebellum, which is antero-inferior cerebellar artery, and another one, which is superior cerebellar artery, also arise from the basilar artery. The terminal branches of basilar artery are the two posterior cerebral arteries, which complete the Circle of Willis posteriorly. So here now is a diagram which is showing us the inferior aspect of the brain. And here you can see this here is the Circle of Willis. Now, as you can see that this is a circle or ring which is roughly hexagonal in shape, and it is formed by the anterior communicating artery, by the anterior cerebral artery, and then you can see this here is the internal carotid, and then posterior communicating, posterior cerebral, and the basilar artery. And over here, you can see this basilar artery is giving pontine branches, and also you can see over here it has been formed by the union of the two vertebral arteries. This basilar artery is also supplying the cerebellum by antero-inferior cerebellar branch, and also you can see it is supplying cerebellum through the superior cerebellar artery. Whereas the vertebral arteries are giving off the posterior-inferior cerebellar artery, which is going to the posterior and inferior surface of cerebellum, and also you've got this anterior spinal artery, which is formed by contributory branches of both the vertebral arteries. So the location of Circle of Willis is in the interpeduncular fossa at the base of the brain. Let's go back to this diagram. Here, the Circle of Willis is surrounding this central area on the base of the brain, which is known as the interpeduncular fossa. Over here, it has the optic chiasma, and it also has the infundibulum. Now, there are 6 vessels, namely, forming the Circle of Willis. If we look at the axial arterial anatomy of the brain, we can simply draw and point out these vessels which are forming the Circle of Willis. So here is number 1, that is the anterior communicating artery. And then is the number 2, which is the anterior cerebral artery. Then you have number 3, which is the internal carotid artery, forming the Circle of Willis. And then we have number 4, which is the posterior communicating artery. And then number 5, which is the posterior cerebral artery. And then comes number 6, which is this here, vertebro-basilar artery. So here, these are the 6 vessels which are forming the Circle of Willis at the base of the brain. What is the importance of the Circle of Willis? Well, it facilitates the distribution of blood to different parts of the brain. And if there is going to be, under any abnormal situation, some blockage or occlusion of the vertebral or internal carotid artery of one side, because of the presence of Circle of Willis, the blood will still be flowing across the midline. So the Circle of Willis provides alternate blood pathways. It also provides collateral blood flow between the anterior and posterior arterial systems of the brain. And eventually, the advantage of this collateral blood flow is that this protects the brain from ischemia, which means decreased blood supply, and infarction, which means the tissue death in cases of vascular obstruction or damage. So here is the dissected brain, and if we magnify the area on the inferior surface of the brain, we will see this here arterial ring, which is the Circle of Willis, and we can see these vessels which are forming the Circle of Willis, the anterior communicating, anterior cerebral, and here the internal carotid, posterior communicating, posterior cerebral, and you can also see the basilar artery over here, which is prominent and present on the anterior surface of this here pons. It is formed by the union of these two right and left vertebral arteries. So, summarizing the blood flow to the brain, what do you have to remember? And this is a very important point that you have to remember, is that the carotid system supplies the anterior part of the cerebrum, that is the forebrain, except occipital lobe. Whereas the occipital lobe, the brain stem, and the cerebellum, these are the parts which are supplied by the vertebro-basilar system. Now we're also going to look at the Circle of Willis on a digital model, so you can get a better concept of this very important arterial anastomosis on the undersurface. So here we have a digital model of the lower half of the skull, focusing on the Circle of Willis. So as you can see, this is the interior of the skull, and here is the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. So this larger opening in the posterior cranial fossa is the foramen magnum. And now we are looking at this Circle of Willis, which is an arterial circle on the undersurface of the brain. And the location over here is that it surrounds the hypophyseal fossa. So we're going to zoom in on this circle, and we are going to look at the blood vessels which are forming the Circle of Willis. As I told you, there are two sets of arteries which are entering the skull. Over here, the anterior one, labeled number 5, is the internal carotid artery, which enters the skull through the carotid canal of the temporal bone. And as it enters, it then travels through the cavernous sinus, and then it terminates by dividing into, you can see over here, the anterior cerebral artery and the middle cerebral artery. The anterior is the smaller terminal branch, and the middle cerebral artery, labeled 16, is the larger terminal branch of the internal carotid artery. But before it divides, it gives off this branch, number 8, which is the ophthalmic artery, which travels through the optic canal into the orbit. And over here, another branch is the posterior communicating, labeled number 10, which completes the Circle of Willis by joining with the posterior cerebral artery. So let's look over here at the second set of arteries, which are the vertebral arteries 3 and 4. They have entered the skull through the foramen magnum and united at the lower border of pons to form the basilar artery number 18, which is traveling over here, and it is giving off these pontine branches number 19 and also the superior cerebellar artery before dividing into the two terminal posterior cerebral arteries. So this here is the Circle of Willis, where you can see anteriorly the two anterior cerebral arteries are united by labeled 17 anterior communicating artery. And this Circle of Willis, it is surrounding the hypophyseal fossa. It is present on the undersurface of the brain, and it is essential in supplying giving off branches, arterial branches, blood supply to the different parts of the brain. And it also gives us the collateral anastomosis for the advantage that if there is a blockage in one part of the branches or the circle of Willis, then that would be compensated by the alternate blood flow across the blood vessels. So this ends with the short description of the circle of Willis on our digital model. The word homunculus literally means miniature or small-sized human being. Now, why are we talking about a cortical homunculus? That is because this is a physical representation of the human body based on the area of cortex dedicated to the processing of sensory or motor functions of different parts of the body. So we are looking at the representation of the human body on the cerebral cortex, and that representation is the homunculus. As mentioned over here, this representation is based on the area of the cortex, which is dedicated to the processing of sensory or motor functions. So this is why when we draw the miniature human being, the cortical homunculus, we can see the face and the hands. They are the largest parts of the body. This is because these are the parts of the body these are the parts which have a greater representation, a greater area of representation on the cerebral cortex regarding the motor and sensory functions. Now, if we were to spread out this miniature human being, that is the homunculus, onto the surface of the cerebral cortex, then it would look something like this. This section is a coronal section, which you can see at the inset over here. This is a section which is dividing the cerebrum into anterior and posterior parts. So here we're looking at the coronal section, and this is the medial surface of the hemisphere, whereas this here is the lateral surface of the cerebral hemisphere. Now the homunculus, its lower part, that is the leg and the foot, they are hanging on the medial surface of the cerebral hemisphere. So this is the area where the leg, foot, toes are represented, as well as the pelvic region and the genitals are represented. Now, when we come to the lateral surface of this cerebral hemisphere, we can see the trunk, the head, shoulder, and the arm, and especially the hand, you can see is very large because it has a large area of representation on the cerebral cortex. Also, the different parts of the face, whether it's the eyes, nose, lips, or tongue, they all have a large area of representation on the cerebral cortex. And here is a color-coded representation of those areas in correlation to their blood supply. This is again a coronal section, and the area which we see in blue is that area which I just showed you over here, the area which is representing the lower part of the body, that is the leg, the feet and the toes, and also the pelvic region. This is the area which is supplied by the anterior cerebral artery. And remember, this area is also known as the paracentral lobule, which represents the extensions of the precentral and postcentral gyri on the medial surface of the cerebral hemisphere. Whereas the red area, the large red area on the lateral aspect of the cerebral cortex, which was representing the upper part of the body, shoulder, the arm, and the hands, and the face, this is the area which is supplied by the middle cerebral artery. The remaining parts of cerebral cortex, they are the areas which are supplied by the posterior cerebral artery. So when we talk about these areas, we are going to now summarize the supply. The anterior cerebral artery supplies, now these branches can be divided into two sets. Each cerebral artery, its branches can be divided into cortical branches and the central branches. Now, when we talk about the cortical branches, we mean the part of the cerebral cortex that is supplied by this artery. So the anterior cerebral artery, as I just showed in the diagram, was supplying all of the medial surface. And remember, it also supplies the adjoining 1-inch strip on the superolateral surface of the frontal and parietal lobes. And this is the lower limb area. Whereas the central branches of anterior cerebral artery, these are the ones which supply the other parts of the brain, namely the anterior 4/5 of corpus callosum. Corpus callosum is the large tract which is keeping both these cerebral hemispheres in communication with each other. So these are the fibers which are known as corpus callosum. The anterior limb of internal capsule, the internal capsule are the projection fibers, and they are also supplied by the anterior cerebral artery as well as some parts of the basal ganglia. Now, let's look at the area of supply middle cerebral artery. Its cortical branches, as I showed in the diagram, are supplying mainly the lateral surface of frontal, parietal, and also the upper temporal lobes. So this represents all the parts of the body except the lower limb area. Whereas the central branches are going to supply the remaining parts of internal capsule, that is the posterior limb and genu of internal capsule, and the larger parts of the basal ganglia. You know the basal ganglia are the corpus striatum and the lentiform nucleus. Posterior cerebral artery, this supplies cortical branches to the medial and lateral surfaces of the occipital lobe and also the medial and inferolateral surfaces of the temporal lobe. Whereas the central branches are going to supply now the posterior 1/5 of corpus callosum. This is known as the splenium, as well as midbrain, thalamus, and the lentiform nucleus. So here now we are looking at the cerebral hemisphere, which is the right one, and it is its medial surface. And this is a color-coded diagram, which is showing the areas of supply of the 3 cerebral arteries. So here on the medial surface, you can see this is the area which is blue. It is supplied by the anterior cerebral artery, whereas the medial surface of occipital lobe, that is supplied by the posterior cerebral artery. And if you look at the lateral surface of the right cerebral hemisphere, the adjoining strip, about 1 inch, is also supplied by the anterior cerebral artery, but the larger part of the lateral surface, which includes the lateral sulcus, that is supplied by the middle cerebral artery. And a small part of the occipital lobe, its lateral surface, is supplied by the posterior cerebral artery. Okay, so if we were to look at a coronal section of the cerebral hemispheres, then we would see that this here you can see is the middle cerebral artery. Its branches, they are entering the area of the basal ganglia, and these branches are known as the medial and lateral striate arteries. So these represent the central branches of the middle cerebral artery. Okay, now before we go any forwards, there's some basic facts you need to know. What happens if the blood flow to the brain is completely cut off? Well, in that case, we would lose our consciousness within 5 to 10 seconds, and the function of the brain neurons would stop after about 1 minute, and irreversible changes leading to brain damage, they start to occur after 4 minutes. So what is a stroke? Also known as the cerebrovascular accident. Cerebrovascular accident, this can be either a thrombotic stroke or an embolic stroke, or it can be a hemorrhagic stroke. Now, thrombotic stroke happens when there is some narrowing in the artery over there at that particular location, and that causes the obstruction to the blood supply or blood flow to a particular area of the brain. Whereas an embolic stroke originates from a blood clot which has originated somewhere else, but then it travels through the Circle of Willis, then through its branches, causing occlusion of either of its branches. A hemorrhagic stroke is due to the bleeding of the artery, which compromises the blood supply to a particular area. So these can be the different types of stroke, and stroke will then, of course, affect the brain tissue. And as I just mentioned, that within few minutes, it can cause the death, the permanent damage, that is the infarction of the brain tissue. So now that we've discussed the basic anatomy of blood supply to the cerebrum, we are now going to be talking about the cerebral artery syndromes. That is the clinical outcome of the occlusion in case of an occlusion of any cerebral artery. So first thing you've got to remember is that the signs and symptoms produced after occlusion of a cerebral artery, of course, it depends on the site of the occlusion, and it also depends on the development of any alternate route of supply, that is the collateral anastomosis. So first we'll talk about the anterior cerebral artery occlusion. Well, if there is occlusion in the anterior cerebral artery, based on the areas of supply which we just discussed, there is going to be a contralateral hemiparesis, which means this is the spastic paralysis, or you could say paresis, that is the partial paralysis or weakening of the muscle function, and hemisensory loss, that is also known as hemianesthesia, involving mainly the leg and the foot, because the area of representation of anterior cerebral artery on the cortex is the paracentral lobule, and therefore this is the part of the body which is going to be affected, and it is the contralateral loss which occurs, which means on the opposite side of the body, because we know that the right-sided anterior cerebral artery is going to present the blood supply to the right cerebral hemisphere, and that is going to produce the opposite actions, the opposite sensory and motor functions. And so there is going to be the contralateral loss in that case. Now, if we were going to look at some other results or clinical outcomes of the anterior cerebral artery occlusion, astereognosis is a condition which can occur in which the objects cannot be identified on the basis of touch, and this occurs when the parietal lobe has been affected. If the prefrontal lobe is affected, this can cause changes in personality or apathy. It can also cause urinary incontinence. This usually occurs in case of the bilateral artery involvement. And this occurs because the pelvic area, that is, you can see that is a specific area which is also represented in the area of supply of anterior cerebral artery. Another condition which can occur is the transcortical apraxia. Now, what is transcortical apraxia? This is an example of a disconnect syndrome. This is because of the impediment of blood supply to the corpus callosum. As I told you, corpus callosum are the association fibers between the right and left cerebral hemispheres. So because of the involvement of corpus callosum, the patient cannot raise their left arm in response to a verbal command. Now, the left arm specifically cannot be raised because this is something that, if you recall from the previous lectures, I told you that in the majority of the population, 80% of people, we are right-handed, which means our dominant cerebral hemisphere is actually the left cerebral hemisphere. And this is the hemisphere which has the speech and the language centers. So what happens is that in response to the verbal command, the you could say the information for the execution of the verbal command, that is raising of the left arm, has to go from the left cerebral hemisphere through the corpus callosum to the right cerebral hemisphere to make the patient raise their left arm. But since the corpus callosum has been compromised, this transfer of information cannot occur, and that is why the patient cannot raise their left arm in response to a command. But they can raise their right arm in response to a command, because in that case, the information has simply to go from the language or language center of the left cerebral hemisphere to the motor center of the left cerebral hemisphere itself. Okay, what about occlusion of middle cerebral artery? What is that going to lead to? In this case, there will be contralateral hemiparesis, that is the spastic paralysis or paresis, and hemisensory loss involving mainly the face and arm, because this is the area which is represented by the middle cerebral artery. And also keep in mind, specifically if the left hemisphere is affected, like I told you, it's the dominant hemisphere, then certain language deficits may occur, which are known as aphasias. This might be the vernix aphasia, also known as the sensory or fluent, also known as the receptive aphasia. What happens over here is that there is an impediment in the comprehension. There is a problem with the comprehension or understanding of the spoken language. Although patient can produce words, but the words are produced in a way which is known as a word salad, that is in a large number, not making any sense, but the patient themselves are unaware of their condition, so they're not distressed. There might be Broca's aphasia, which is due to the affection of, motor speech area involvement. This is also known as the expressive aphasia or the non-fluent aphasia, because in this case, there is a problem in the piecing together of words, in the production of the words. The patient does understand the spoken sounds, but the patient cannot produce their words, so they are frustrated, they're aware of their condition. If there is a combination of vernix and Broca's aphasia, it is known as global aphasia. And if there is involvement of the arcuate fasciculus, which is connecting the vernix with the Broca's aphasia, then in that case, the condition which takes place is conduction aphasia, in which the patient cannot repeat the words or respond to the verbal commands. And then there could be the Gerstmann syndrome. Well, the Gerstmann syndrome involves the angular gyrus, which is in the parietal and temporal lobes. And Gerstmann syndrome has a different constellation of features, which includes there could be alexia, that is the problem with the reading of the words, agraphia, the writing of the words, and then also acalculia, in which the patient cannot do the simple arithmetic problems, finger agnosia, in which the recognition of the fingers is disturbed, and also right-left disorientation. So all of these different conditions, they are they're occurring within the terminology, the condition which is known as Gerstmann syndrome. Now, what happens if the cerebral artery, middle cerebral artery occlusion has affected the right or non-dominant hemisphere? Well, then the specific symptoms which can occur are the asomatognosia, which is an inattention and neglect of the opposite side of the body. So the somatosensory or the visual world, which is on the opposite side of the body, is going to be neglected by the patient. Anosognosia. Now, this is a condition which the patient simply is unaware of their own disability, and there might also be the spatial perception defects. So these are the different conditions which result in case of the involvement of the non-dominant, that is the right hemisphere. Now let's come to our third cerebral artery, which is posterior cerebral artery. We know this is supplying the occipital lobe, which has the visual cortex. So if it is occluded, this will cause the contralateral homonymous hemianopia, which means the loss of the half of the visual fields. And it will be hemianopia because half of the visual field is being affected, and homonymous, which means it will be of the let's suppose if we say that it is of the right posterior cerebral artery occlusion, then there will be the left-sided homonymous hemianopia and vice versa. Now, when we say macular sparing, we mean that the macula will be safe. The macula will be spared. The reason is that this is the central area of the field of vision, which is supplied or by a dual blood, it has a dual blood supply, also by the middle cerebral artery other than the posterior cerebral artery. If the dominant hemisphere, that is the left one, is affected, then alexia without agraphia, that is the pure word blindness, can occur. And memory can also be affected because of the involvement of temporal lobe. So now that we have summarized the different cerebral artery syndromes, we are going to discuss the veins of the brain quite briefly. You should know that the veins of the brain, they do not have muscular tissue or valves, and they're also lying in subarachnoid space, and eventually they drain the substance of the brain into the cranial venous sinuses. The cranial venous sinuses are present between the two layers of the dura mater. Now, these veins of brain can be divided into two sets. One of these is the external cerebral veins, and the other one is the internal cerebral veins. So let's look over here at the external cerebral veins. If you follow the pointer, you will see these here superior cerebral veins. These superior cerebral veins, they are draining the lateral surface of cerebral hemisphere into this here superior sagittal sinus. Also, you can see this superficial middle cerebral vein, which travels in the lateral sulcus of the cerebral hemisphere, and it is also draining the lateral surface of the brain, and eventually its blood goes into the cavernous sinus. There is also a deep middle cerebral vein, which is draining the blood from the insula. If we look at the deeper veins, we remember there are two paired internal cerebral veins, and these two internal cerebral veins, they're traveling in the upper part of the third ventricle, and over here they join to form the great cerebral vein, which also receives the basal vein, and eventually drains blood into the straight sinus. So now we're going to discuss a few MCQs. Now that we have covered the basic aspects and discussed the clinical correlation of blood supply of the brain, now let's look at the clinical scenario in MCQ number 1. So there's a patient who suffered a stroke caused by occlusion of the right anterior cerebral artery. This patient is most likely to present with, now since there is occlusion of the anterior cerebral artery, we know it represents the area of the leg and the foot. And because it's the right anterior cerebral artery, it's the contralateral side which is going to be involved. And this is a hemisensory loss, so loss of pain and temperature sensations in the left leg. E is the correct answer for this MCQ. Now here's the second one. Your patient has a language problem involving an impaired ability to repeat an examiner's commands. Their speech is fluent and comprehension seems intact. If this is the only language deficit, the impaired ability to repeat an examiner's commands, then B, conductive aphasia would be the answer, in which there is the arcuate fasciculus involvement, which was the connection between the Broca's and the vernix areas. Now here is an MCQ 3 in which you have a female patient who suffered a stroke. She has difficulty copying simple diagrams, even though she hears and understands your requests to do so. You notice that she only has makeup on the right side of her face and doesn't seem to know where her left hand is in space. Which blood vessel might have been occluded to cause these symptoms? But here you can see this is a condition in which there is constructional apraxia, that is, she cannot draw or copy the simple diagrams. Also, she is neglecting the left side of her visual and somatosensory world, which means it is the right-sided parietal lobe which has been affected, and this area is the right middle cerebral artery area. So B is the correct answer for this MCQ. Okay, so this concludes with today's discussion on the blood supply of the brain. All you need to know, we covered all the basic aspects. We also we looked at the Circle of Willis on a digital model, and we discussed the cerebral artery syndromes. So this is a very important topic, and if you enjoyed today's session, don't forget to like and subscribe to my YouTube channel, Anatomy Mentor. You can do that by just clicking on my picture, which is going to appear at the end of this video. And also don't forget to hit the bell icon so you get notifications of any updates. So thank you and stay blessed. And next time, I'll be coming soon with another topic. Till then, goodbye and take care.